Hey, good morning, everyone, or afternoon, I'm sorry. It's Brandon with the National Minority Quality Forum here. I'm excited about today's conversation as we have, our very own Mia Keeys, who is now Chief of Staff, as we announced last week, to Congresswoman Robin Kelly. And we have Jirair Ratevosian. They are both members of our they're both 40 under 40 winners, the first and second class, and then they're also members of our advisory board. And so they wanted to, I wanted them to, they are both doctoral students as well, getting their PhDs, but they are a bit of focus on global health. So they've had a lot of experience there, and they've both lived abroad all over the world. And I would love for them to just talk about what's happening in the world of health right now. So without further ado, I'll turn it over to Mia.
Thanks, Brandon. As always, I'm really excited about my Friday midday, the time period I get to spend with NMQF and the folk over here and the people who tune in. So thank you everyone for your attention and time today. What I will say before we get into our conversation, I imagine that everyone will have questions or comments. Please definitely keep the engagement up. Put your comments in the comment area in the chat, and then give us your questions in the Q&A below on the panel on the bottom of your screen. So as Brandon mentioned, we're joined today by Jirair Ratevosian, who is not only a doctoral student at Johns Hopkins, but he is a longtime global health advocate, and also someone who has come from the Hill some time ago. I'm actually going to take some time to read his full biography, because I think it's always really important, especially when we have the time to get into that.
Mia, don't do that, please.
I'm going to completely embarrass you. You don't want me to? I want to, if that's okay.
Sure, but it's going to be embarrassing, but okay.
So Gerard is the executive director of Gilead Sciences, although he comes today to talk to us in his NMQF advisory board position and as a doctoral student, and someone for whom global health is really very close to his heart. He leads the government and multilateral engagement portfolio, which includes global health. It includes the continents of Africa, Asia, Central America, and also areas in the Caribbean. In his present role, Gerard represents the private sector on the board of the Global Fund to fight AIDS, tuberculosis, and malaria. And before he was with Gilead, he was the LD, the legislative director to Congresswoman Barbara Lee out of California, where he led the foreign policy and public health portfolio and also advised on legislative issues, which included everything from Ryan White to the President's Emergency Fund Plan for AIDS relief, or PEPFAR, the authorization of use of military force. And Gerard overall just has an extensive knowledge of global health financing, development policy, multilateral donors, including the Global Fund and the UN. And through his various positions, he has extensive experience in negotiations with other governments, with foreign governments, with fundraising and developing strategic partnerships and coalitions with a wide range of stakeholders, including private sector, government, and civil society. And later on, he also held positions at AMFAR, at APHA, the Centers for Democracies in the Americas, positions for human rights. He's here in DC. He has a master's degree in public health from Boston University School of Public Health. And as I mentioned before, he's a current doctoral student at Johns Hopkins Bloomberg School of Public Health, with a specialization in health diplomacy and global health governance. So Gerard, I don't really care that I may have embarrassed you a little bit. I think it's really important to set the stage here in terms of what you bring to this conversation and why I'm so very excited to have you here today. So welcome.
Thanks, Mia. Thank you very much. That was painful, but I appreciate that. And it's nice to be with you. We should congratulate you too on your new gig of Chief of Staff. And I'm really pleased to be with you and others during this hour.
No doubt about it. I appreciate the warmth. And as Brandon alluded earlier, you and I both have really very high stakes and investments in the global health conversation, right? So for those of you in the audience who may not know, prior to my really getting entrenched in the health policy on the domestic side via the congressional space, I spent a lot of time abroad. So prior to graduate school, I lived abroad for about 4 years, initially in South Africa, where I conducted HIV and AIDS research during a really very tumultuous time. It was actually the year of the World Cup when I lived there. So you can imagine when the country's investing in all kinds of efforts and endeavors to bring a bring a foreign audience over to enjoy its land, it also means to some extent it siphons resources and such like that from everyday needs of its people, including electricity, water, clean water, and such like that. After my time in South Africa, I moved to Indonesia, where I was a U.S. Fulbright Fellow for a year. Initially, it was supposed to be a year. I ended up staying for 3.5 years, and in various parts of the country, everything from very remote areas where, and at the time I had very long locks, so no one had ever seen anyone quite like me, to living in the capital of Jakarta, which is like New York on steroids, if anyone's ever been there. But I lived in the landmass that's closest to Bali. That's usually what I tell people if they're not familiar with Indonesia. But in terms of living abroad, being immersed in these global spaces, it really opened my eyes, Gerard, to the significance of understanding our U.S. healthcare system and what that means in relation to what the world goes through. What the world experiences in terms of access to quality and competent care, in terms of being able to have conversations and be empowered in a public health way, not even just within clinical traditional spaces, right?
Yeah.
And so today's conversation, we're really going to focus on global health and health inequities, especially within the context of COVID-19 and vaccines. And so, Gerard, I'm wondering if you can give us just some foundational words about what brings you here today, why this topic means so much to you, and then we'll go ahead and talk about vaccines and the state of affairs across the world.
Sure. Yeah. No, thanks so much, Mia, and thanks for sharing your own personal journey as well, because we are products of our journey and our experiences and where we come from and who we are, right? And it was the same. I had the same set of dynamics from my own self. When I was in college out in Los Angeles, I wanted to be a doctor. Everything I did was geared towards going to medical school. I was a good Armenian kid who was going to be either a doctor or an engineer or a lawyer. Lawyers are also decent too. And so I did everything geared towards medical school. But what happened was right around, it was the fifth year of I was a double major, so I did my bachelor's degree in 5 years. I had the experience to go to South Africa, and it was like I had won a competition, and I went to Johannesburg. And so this would have been, I'm going to date myself now, but this would have been around 2002. And it was really at the early stages of the global HIV response. And I too was, I was not going on a healthcare trip. This was a trip to take photographs. This was a photography scholarship. And I just was, what I was exposed to in Johannesburg and also in Durban. This is the first time for leaving Los Angeles, leaving the country. I carry those images with me until today. And those, what we saw were clinics and people struggling to fight an epidemic that was just beginning to spread, and it continues to be a struggle now. But that forever changed the way I thought about healthcare as well. And I realized that, I think I could have had more impact working on health policy issues and public health matters. And so I did a full, well, maybe not a full 360, but a 180 to public health, and that got me more involved in HIV. Then I went to grad school at BU, as you said, and almost all of my career, my professional career, and a lot of the personal organizations that I'm involved with touch on HIV. And working on HIV throughout my career has been a lens and a window into not only inequalities around the world, but also here in our own country as well. Those inequalities remain, and human rights violations still exist in some parts of our own country, all over the world as well, including recognition of LGBTQ populations, of injecting drug users, of sex work as real work. All of these challenges hamper ability to fight HIV, and it's gotten me more involved in social justice. Even working for Congresswoman Lee, as you mentioned, who's a congressional champion on HIV, that gave me the opportunity to work on health policy issues with the CDC and the Tri-Caucus and you and Brandon and others, and so it made sense for me to then come to Gilead, which is a leading company working on HIV. and do this work now for them in Africa and Asia, where we're developing partnerships for access to our medications and also public health solutions for governments and other stakeholders. The COVAX work is an extension of that work, which I'm happy to talk about. Right now, we're seeing COVID-19 play out in very similar ways to the early HIV days. And a lot of people have written about this, and the inequalities, not only in communities of color in our own country for access, are very similar to the early days of the HIV response. And the inequality globally to vaccine access mirrors exactly what we saw in those early days of the global HIV fight when I was in South Africa. So for me, it's the next frontier. And even though the HIV fight is far from over, as someone who is fighting social justice, I've taken on COVID-19, and the work is all very much connected.
Sure, I really appreciate you walking us through your narrative, and then also the ways in which your own personal narrative has helped you to look now at the work that you're doing with the COVID-19 vaccine, with the COVAX work. Yeah. So I'm wondering, can you let's pivot first and foremost and talk about what's going on in the U.S. with respect to vaccination efforts, right? So here in the U.S., we are now in a state, and to your earlier point, we're by no means at the most ideal state, but about 50% of Americans or residents here in the U.S. are currently vaccinated. I think the most recent stats I saw was about 49.5%.
Yeah,
right?
Fully vaccinated, yeah.
Yes, exactly. But how does that compare, Gerard, to what we're seeing around the world and specifically throughout the continent of Africa? Because a lot of your work, as we talked about, is on the continent. It focuses also on Asia and the Caribbean and South America. But let's talk about where you're spending most of your time and what rates are you seeing?
Yeah, so the situation around the world is mixed, and the inequalities are stark, as I had said earlier. A recent Kaiser analysis, actually this week, showed that only 1% of people in low and middle income countries are fully vaccinated, and that compares to 51%, as you mentioned, in high income countries. Think about that, 1%, and so it comes as no surprise, as right now what's happening is that the weight of the pandemic is shifting from high income countries, wealthy countries like ours with large vaccine supplies, to poor countries who are still struggling to secure those vaccine supplies. And that's especially true in Africa, as you said. And last week, the World Health Organization reported a 43% week-on-week rise in COVID-19 deaths across the continent. 43%, and people are still dying of COVID. Here, we're struggling to get people vaccinated. There, they only have a 1%, 20 million people are fully vaccinated across the whole continent of over 1 billion people. And as the World Health Organization said, 43% rise on COVID-19 deaths. So we're long ways to go from even reaching any population level coverage in any of the countries around the world, especially in low and middle income countries. And there are a number of factors for why those challenges exist.
It's not lost upon me when I'm thinking back to a year and a half ago when COVID really first came into the American conversation, and then the shutdown, hit by March or so. One of the things that really struck me was in terms of the media letting us know who was initially impacted or had contracted the virus. It was like Tom Hanks and his wife. Right. I remember that distinctly because he's one of my favorite actors. Right. And so we were having this conversation about people who are really very powerful media figures. They were being treated initially. They were the ones that narrated the scene, if you will, on COVID, at least stateside, even though I think at the time they were in Australia filming for something or other. But then the conversation started to shift, and we started to see, in terms of those who were being impacted detrimentally, we're talking Black and Brown populations. We're talking Indigenous. We're talking about Navajo Nation, which especially in the beginning, was ravished with COVID, more so than compared to the state of New York and the state of California. And now we see the same shift with respect to the vaccines, right? Where initially those who were being, who were gleaning access in terms of countries, if you will, it is the higher income countries compared to the global South and low and middle income countries. What are major challenges, in terms of why we are seeing that? I mean, I know we know, but let's talk through that.
Well, we don't really know. We have some idea, and we don't have good peer-reviewed publications about what's actually happening. And so this is what part of my thesis is looking at, and many others are looking at it too. So, but we have, in terms of reporting, in terms of what organizations that are watching this space are saying, we have a sense of what some of those challenges are. I just want to take back and just acknowledge that we're talking about vaccines. It's a year and a half into this pandemic, and the fact that we have a vaccine, first of all, is some sort of miracle, because those of us who've been fighting HIV for 30 years, we're still waiting for a vaccine.
That's right.
And so we have to acknowledge that companies, and I know that there are a lot of representatives here too from other companies, they conducted clinical trials at record-breaking speed for diagnostics, therapeutics, vaccines. Gilead has a treatment for COVID-19 as well. But while science over-delivered, so to speak, the global community missed the ball on delivery, on procurement, on distribution, on community engagement, all of these implementation issues that we should have learned lessons on because of all of these other global health issues that many of us are working on, including HIV, including malaria, TB. There's a lot of, we have decades and decades of experience trying to solve these global health challenges. And with COVID, it's like we started brand new from day one, and that was a big part of our failure to implement, so to speak. So to understand what's happening now with the vaccine delivery, it's important to understand how vaccine is being delivered. And just so, if you'll just entertain me for a minute, I was just going to explain the structure. So in April 2020, you mentioned the shutdown, and that was what, fourth week of March last year. Basically 2 weeks after that, in early April, the World Health Organization, the European Commission, France, the Gates Foundation, and a couple other countries, not the US, launched what was known as the Accelerator. You guys have heard of this. This was a brand new thing, a new shiny instrument, and it was charged to develop and deliver vaccines, therapeutics, and diagnostics. The vaccine arm of this initiative was called COVAX. That's what we're talking about today. And COVAX is run by 3 different organizations: Gavi, which you may have heard about, which is the International Vaccine Alliance; CEPI, the Coalition for Epidemic Preparedness and Innovations, I think that's what it stands for, and the World Health Organization. UNICEF was also involved as well with delivery and procurement. Within COVAX, now stay with me, there are 2 entities. There's the facility, COVAX facility, and the COVAX AMC. The facility is like, think of it like the Amazon marketplace, where high-income countries are pooling resources to make deals with the pharmaceutical, for the manufacturers of COVID vaccines. And then the AMC is for low middle income countries. It's a financing mechanism so that they can have access to COVAX vaccines. And that's about 92 countries that were available for that. The point here is that through the facility or the AMC, 90% of the global population is covered by this mechanism. So the point here is it's a BFD, as our president says, right? And this is a mechanism that touches almost all of us, 9 out of 10 of us. When it was started in April 2020, they said the goal was to deliver 2 billion doses by the end of this year. And it would cover 20% of the global population. And people said it's not enough, but still a worthy goal. And to date, it's only delivered 200 million of that 2 billion. And so there are a number of factors that contributed to the major shortfall that COVAX faced. First and foremost, it had a weak bargaining posture. So it was competing with high-income countries that were buying the same vaccines that COVAX was trying to buy. The United States, under President Trump, had Operation Warp Speed. And through all of the advanced purchase agreement deals that we had, we had over 1 billion vaccines in our possession. This is at the same time that COVAX was trying to make deals with the same companies. UK, Canada, European countries were doing the same deals. So COVAX had a weak bargaining posture. They didn't have enough financing. A number of country level challenges have also become more, have come to the forefront, is what I'm trying to say. I mentioned a few of them earlier, but last mile delivery challenges, how do you get them to rural populations? We have that problem in our own country as well. How do you have enough healthcare workers trained and sensitized to have to do these vaccinations? We have some of those healthcare worker challenge issues are in our own country. And then if you have a vaccine approved in the US, it doesn't mean it's automatically approved in Ghana or South Africa. You have to go through each one of these countries and get regulatory approval and jump through policy hurdles. And so companies have to deal with all of those. COVAX have to deal with them one by one as well. And then there are vaccine hesitancy issues in communities across all around the world. And that was a major challenge that we were not prepared, COVAX was not prepared to face. And so all of these things have factored into the slow rollout, the vaccine shortage. And in some parts of the world, including in Africa, you saw the emergence of parallel vaccine procurement efforts. And the African Union here is actually demonstrated tremendous leadership under John Nkengazong, the director of the Africa CDC, which is 5 or 6 years old. But what they've done is they've developed their own financing mechanism and procurement mechanism. They said, we're not waiting for this COVAX thing to come to help save our population. We're going to be doing it on our own, and we're going to pursue vaccine manufacturing on our own continent. And so those have also added to the competition in the marketplace, but are now beginning to help solve some of those shortage challenges. Earlier this week, we had there was an event with John Nkengazong, the Africa CDC director, who reported that because of what the AU had done in the early days, the deliveries on the continent are now are happening faster than COVAX, and that's major progress. It's in the area of sustainability and resilience. It's what should have happened from the beginning, but the AU now is making tremendous progress. And for those who don't follow the Africa CDC developments or John Nkengazong on Twitter, I highly encourage you to get plugged into those efforts. They're doing great work, and not just for COVID-19, but for a host of issues that the continent's facing. So hopefully that gives you a flavor of what the challenges are, and some of my doctoral work was also looking to understand that for different countries what those implementation barriers are, and I'll hopefully be reporting the results soon. And one of those countries, by the way, is in Indonesia. So I might come talk to you. So
let's actually segue into that a bit. Tell us a bit more about that work, and then we'll get back to some other questions I've got for you.
Sure. Yeah. So this might bore people, but the hardest part about doctoral work is developing a framework, and as you know, Mia, and a conceptual framework for what you're trying to do. And so I wanted to, the appreciation I had for implementation challenges. Just because you have a new vaccine, it doesn't mean person XYZ is ready to take it, right? And so, but you would be surprised how many times we keep having to learn that lesson, no matter what new innovations come to light, or anything, even consumer products as well. You have to understand what people are looking for, what they need, what the challenges are with regards to implementation. And so I developed what's called an implementation science framework, which I'm applying to 4 different countries, and there'll be Indonesia, Chile, South Africa, and Armenia. And what I want to do is I'll be interviewing key informants in those countries. I'll be interviewing stakeholders in the broader policy and programmatic space, and have designed interview questions to understand some of those rollout challenges, those implementation challenges, and the data will inform recommendations for not only COVAX rollout, because COVAX is with us for a few years, if not longer, but also how do we finally learn these lessons so that when the next pandemic comes, because we all know it's going to come at some point, we're not having to learn these same lessons over again.
And so timely, and especially because with each of those countries that you've named, I don't know as much with respect to Armenia, so correct me if I'm wrong, but we're talking about countries that are ranked within the top 5 of our most populated nations.
Yes.
And so, especially with Indonesia and with South Africa. So it would behoove us to have additional information and knowledge about what's going on within those countries, and certainly to think about it in a way that informs the way that we move, multilaterally and then also within the US.
Yeah, no, and that multilateral point is a good one, because the reason why I picked those countries is, first, when you're designing a study, you want to have good geographic variation, right? But I also want, one other part of the story of this rollout, which we haven't really talked about, is the influence of China and Russia. China and Russia developed their own vaccines, and so they made, very early on in the pandemic, they made diplomacy gestures with a lot of countries in their sphere of influence. China went to Indonesia, and Russia went to Armenia, and they were giving out their vaccine. And we have very little information about the efficacy of these vaccines. And now we know, with real world evidence in Indonesia, also in Chile, mass vaccinations with the Chinese vaccines are not necessarily proving effective against the Delta variant. So these are major challenges for those countries. So I picked those countries because of the influence that they have from China and Russia vaccines, which are a big part of the public health story, which is still very much uncertain.
Yeah, and we have to have ears to it, even though, diplomatically, it's not the easiest conversation to have. We have to have ears to it, because it's going to matter. It certainly matters now, and it will absolutely matter 10 years from now. And to your point, certainly when the next pandemic hits, right? And we need to be better prepared. And having the hard conversations is a significant challenge, but it's also strategic.
Yeah.
So you mentioned, the Delta variant, right? What do we, in terms of this conversation, how should we be thinking about the fast pace of the Delta variant compared to the rate of vaccination rollouts in various countries, including in the US?
Yeah, so it was our CDC director who said that or was it President Biden? Well, a senior US government official said that we're having pandemics among the unvaccinated, right? And the Delta variant is now accounting for, and there's Alpha, Beta, Gamma, and Delta. There are 4 primary variants of concern, as they're called, but there are many variants circulating, and this is a natural evolution of viruses. And there will likely be more and more infectious variants in the future. And so when you look at new infections around the world, and I don't have the numbers on hand, but the Delta variant is the one that is primarily causing most of the new infections, and for primarily among those who have not been vaccinated. So in countries, we just talked about the 1% of the populations that are covered across the continent. Imagine all of those, most of those people are getting new COVID infections. That's where the Delta variant is thriving. If I'm a variant of a vaccine, that's exactly where I want to be. And we've created this situation where the variant flourishes and replicates and potentially even creates even dangerous variants in the future. And so that's why these issues are not just numbers, or they're not just some guy's doctoral thesis. These are very important. When we say global equity and vaccine equity, we're all literally in this together, right? If it doesn't matter if we're all vaccinated here in the US, we can't go anywhere, or if our friends and brothers and sisters around the world are not vaccinated, that doesn't do anything to fight COVID-19 globally. This will be with us forever, and if we don't all take our own personal responsibility to educate our friends, our family, and I had to have some tough conversations with my own family back in LA about hesitancy, we're going to have to be fighting this fight for years, and we're never going to go back to quote unquote normal. And so in low middle income countries, they're already fighting this variant, and it's, as they're trying to increase their vaccination rates, and we can only hope that because what's happening now is, as more vaccine doses are being rolled out, that some of these countries will be able to better handle where their pandemics are, but we're still far from over. It's still far from over.
Far from over, indeed. And you use the noun fight. It really is a fight, right, on so many fronts. But even more close to us are, fights that we endure on a daily basis, and really the unrest that is concurrent with not just the vaccine rollout, but with rates of COVID-19 overall, Delta variant or otherwise, right? And so how do we, on the global front, I think sometimes when we hear stories about civil unrest in global southern nations and low and middle income nations, it might phase us if it feels like it's on the brink of war. But for the most part, if it's a daily occurrence, a lot of times in US markets don't really pay attention to that, but we ought to, in terms of thinking about the public health implications of COVID-19. So how do we need to think about the impact of civil unrest as the pandemic rages, both stateside and abroad? And what are you seeing in the countries where you're focusing on? What's the impact?
Well, I think I see it as a public health issue, right? And in South Africa, as you may have read about, there's been some unrest in recent weeks because of the situation with the former President Zuma there. Cuba, we're seeing what's happening in Cuba now, and in other parts of the country as well, of the world, excuse me. And these are situations where you have a large number of people gathering, or mostly unvaccinated people. Remember, we're talking about 1% across the continent of Africa are vaccinated, 20 million people. So all of these situations create public health challenges to deal with, and it takes leadership. It takes community leadership and political leadership as well. And we have to create a situation where people can voice their frustrations and practice their civil disobedience, but also have to have we have to remember that we're still in a public health pandemic. This is not over. We might be going to cafes and restaurants here. I'm going to go to a dinner tonight at a restaurant, but this is far from over, and this is not something that the global community is anywhere close to where we are in the United States or in some parts of Europe. So I would say humility. We have to be humble about our own situations, our own challenges, but also what other countries are facing with.
And I know we can become fatigued, compassion fatigued, or what have you. But to your point about assuming a posture of humility, and to your earlier point about us all being in this together, it really does matter that we are able to make even just very quick connections between what's going on in the streets of Minneapolis or in the streets of New York compared to what's going on in Johannesburg and in various places within India and Cuba and so on and so forth, right? It is not completely different, right? So
no, absolutely not.
Yeah, I appreciate you mentioning that. So to that point, though, the U.S. has substantial reservoirs of resources compared to many other nations. While we have partnerships with other nations through, the various platforms you've mentioned before, what role to what extent is the U.S. supposed to be held accountable or responsible for the wellness of other countries? What role is the U.S. playing overall in the global response to COVID? So you talked a bit about COVAX. Expand on that for us a little bit.
That's a tough question, Mia, because I happen to believe, and I assume many of us on the call believe, that the U.S. has an indispensable role that to play, not only for fighting COVID, but just in general with regards to health and security, democracy promotion, human rights protections, just around the world. And we saw what happens if that's not the case, right? And under the Trump administration, the previous administration withdrew from the World Health Organization, which we all know was a senseless act in the middle of a pandemic. They ignored COVAX and this vaccine initiative in the first year. Basically, the US was one of a handful of countries that didn't join COVAX in its first 12 months. So all of the first 12 months of COVAX, the US, the largest, most wealthiest country, sitting on 1 billion doses, completely ignored COVAX. Under the Biden administration, the U.S. engagement has stepped up significantly. It was slow in the beginning, understandably, because President Biden and the administration there's a lot of things that they had to fix and restore in our own country and make sure our own populations were protected as well. But most people don't know, on day one, when President Biden issued executive orders, one of those executive orders was to restore the U.S.'s engagement with the World Health Organization and to join COVAX. You didn't have to do that on Inauguration Day, but the president knew that U.S.'s role globally was not only related to our own health security, but it was a moral responsibility that we had. And so that was early action from the Biden administration. Tony Fauci spoke at the World Health Organization annual meeting at 3 a.m. on Inauguration Day. I don't know if a lot of people know that either, but the meeting was already happening. The U.S. was not planning to attend. It was the first day of the Biden administration, and a decision was made to put Dr. Fauci at the U.S. seat to speak to the World Health Organization and to make the case that the U.S. is coming back and that we're going to be supporting the international efforts. These are important gestures for other nations and for our partners around the world to see and understand that the U.S. is part of their destiny, their response. And since then, the U.S., as I said, been slow, but more recently have been mobilizing a significant amount of resources. They gave $4 billion to COVAX, $4 billion US to COVAX. They rejoined the WHO, of course. And I think more importantly, what we saw happen in June and late May, early June is Secretary Blinken and the president, they announced that the United States was beginning to donate its surplus vaccines. Because of the successes of the early rollout in our own country, we now are sitting on a huge surplus of vaccines. Remember, I said we had over 1 billion doses. And so we're now beginning to push those out to other countries. I think I read this year, as of this week, the United States has already donated 100 million doses to all parts of the world. And they're planning to do another 500 to 600 million through next year. And so these donations, and other countries are also donating. The European Union announced today that they're donating 200 million doses. These are filling the short-term gaps that we have because of all the shortage issues that we discussed. But at the same time, you now are seeing companies partner with manufacturing institutions on the continent, for example, in South Africa with Aspen, with BioVac. And so soon we're going to see the continent producing mRNA vaccines, which is pretty awesome, because we're going to need mRNA vaccines not only to fight COVID, but probably to fight HIV one day and other areas as well. And so the U.S.'s role has been major so far, and I think they're just getting started.
I agree with you. And, you know, sometimes when we think about the terminology donation and you know, we think of goodwill, right?
Yeah.
And which it is. It's very much on, it reflects well on the U.S. in terms of goodwill, but it's also good diplomacy, right?
Yeah.
And not only is it good diplomacy and goodwill, but it's also, in my estimation, one of the best public health strategies that we could ever implement. To your point about
diplomacy,
if nothing else, COVID has shown us that when our neighbor is unwell, then eventually so will we be, right?
Yeah.
And so, especially because COVID did not originate here in the U.S. And so it is really incumbent for us to think about goodwill in the sense of public health and domestic and diplomacy, right?
Yeah. And you know what, Mia, we also have to recognize the role that Congress played too. You know, the
no doubt about it.
CBC, your boss, my former boss, other members of Congress on the Foreign Affairs Committee, House and Senate side, they were pushing for, not only were they pushing Trump to engage globally, but they have also been pushing President Biden to engage globally as well. And so these things don't happen unless you have a combination of accountability and members of Congress being a part of that. And so we have to really thank those members as well.
Yeah, to your point, this is really where science meets public service, and not just within the domestic front. Yeah. I think now that I'm thinking back to the fact that Congress was able to have most of those conversations virtually, right, and really pivot.
Yeah.
You know, it's mind blowing to me that it took a pandemic, but now these are really very stated practices that are going to be within our governance body, where, you know, the conversations must go on, whether in person or globally, or excuse me, or virtually. And we're solving these big problems at a safe distance, and governance has to continue with that. I have a couple more questions for you, Gerard, but I also want to remind the audience, in case you have questions or comments, please give me your questions in the Q&A box below and put your comments in the chat to the side there. Gerard, what are some, you know, now that we're thinking, 'cause you mentioned, you were so very astute in all of your comments. One of the things you mentioned is that, you know, there are lessons to be learned, certainly from the HIV from the HIV pandemic over the last 40 plus years, right? And we still haven't solved everything, but we're certainly coming close. What do you imagine are some of the earliest lessons from this current pandemic as we're preparing for the future?
Yeah, so this is still a story that's being written, and maybe one day we'll see Mia's name on a chapter of this story.
Well, but you and I need to write something together.
Or we'll do it together. Yeah, absolutely. I would be honored to do that. What we know so far, it was well documented in there was an independent panel that the World Health Organization commissioned. And for folks who are interested in learning more about this, I highly recommend it. It was called the Independent Panel on Pandemic Preparedness. And it was chaired by Ellen Sirleaf Johnson, the former president of Liberia, and Helen Clark. And that report, which was released about 6 weeks ago, said some of the challenges included the country level issues that we discussed that were never part of that initial thinking and equation, the slow speed of getting financing, securing donations, liquidity to make those early vaccine deals. As I said, COVAX was struggling to compete with those other countries. They didn't have cash. If you don't have cash, companies are not going to sign deals with you, right? And so we're learning now that maybe we have to create a pandemic preparedness fund and ask Congress for funding for this. And I know there are debates and bills that members are introducing in this regard. Governance was a major issue. While we had WHO as a scientific lead, there was no grown-up. And this is part of that retreat that the US made under the previous administration that we talked about. Everybody was fighting for their own populations, and we all retracted to our own countries and closed our borders. And so when you have nobody in charge or calling the shots globally, you saw nationalism in its worst form. And that played out with vaccines and other arsenals in the toolbox for COVID fighting. And then also countries had weak protocols for prevention and surveillance. This whole notion about weak health systems, which continues to be an issue that PEPFAR and Global Fund and the UN are trying to work toward, is achieving universal health coverage. We're trying to achieve universal health coverage in our own country as well. But these weak infrastructure challenges are now playing out, and people in this space are trying to figure out, how do we do it right? How do we, if we mobilize all of these resources, how do we fight COVID and make sure that these health systems are prepared, we're prepared for the next one? We say it every time, but I think for the sake of humanity, all of us are hoping that this is the time we get it right. And so those are some of the early lessons. And as I said, this is far from over. There'll be more variants. There'll be more orders to have our masks back on, and I think we're going to continue to have to be vigilant and talk to our communities and talk to our friends and talk to and be part of organizations that are doing this work, if you're able to help secure more coverage globally.
Yeah, I really appreciate you breaking it down in that way, Jirair. So in terms of our audience and some of our registrants and people who will watch this in the future, a lot of people are themselves coming from congressional spaces, whether they themselves are members or they are staff. We have a number of academicians who are present. Certainly we have people who are from the rare disease community who are on this call and may be interested in thinking through the global issues and making a connection to what is continuing within their spheres of influence. And then we also have pharma who are present on the registration today. So how is it, because we've talked a lot about public servants, we've talked about the health community. How do we need to be thinking about opening borders, if you will, to conversations with pharma, with other companies or organizations that aren't usually friendly bedfellows, if you will, in the public health sphere?
No, I think that's this whole notion of collaborative partnerships is really important, excuse me. And I think speaking from just my own experience with Gilead, one of the lessons that we learned even before COVID was that innovation and having drugs or vaccines, it's not enough, right? And so we know and recognize that we have to be partnering with NGOs, with community organizations, with governments, with healthcare organizations, traditional healers in certain parts of the world where traditional healers carry important weight. But it's not always easy because we don't always speak the same language. And I don't mean that literally. I mean that in terms of the pharma language versus what implementers speak. And so we rely on organizations like NMQF and others to be that bridge between, to foster those dialogues between the different partners. So I'd encourage people to rely on NMQF and other organizations to have those conversations. In the corporate sector, we work with BCIU, with the Chamber of Commerce, Meridian International, and these are organizations bring different companies together because sometimes even companies don't speak the same language. But what we're learning is that partnership is essential, and it sounds cliche to say, but it's very true. And no one entity can do it alone. And if there is a coalition working together, you're ultimately more effective. So I'm also eager to hear others' views on this, your views on this, and what other models people have found to work, both here in the U.S. and elsewhere.
I'm right there with you. I think especially public-private partnerships are significant, and then in addition to that, ensuring that we have people at the table who may not speak in such high jargon, but are living certain realities and are able to help us to be reminded about your earlier point, humility, and keeping our eye on the ball, especially because there's so many dollars involved in this whole affair of developing not just vaccines, but rollout efforts, and the political power associated with all of this is often really very overwhelming for people to understand. And so if we're able to sit at these tables together and understand what's really at stake, which is the lives of the people who need to be represented at these tables, the voices that need to be uplifted through the work that we're doing, then all the better for all of us. So I'm right there with you on that.
Mia, can I just say one more thing on this?
Please.
And this is something, because my job is all about these kind of partnerships. You also have to realize, again, this is going to sound cheesy the minute I say it, but trust is very important. And if you're sitting with different partners or in a coalition, or you're trying to develop a partnership with an organization, you have to build a foundation of trust. And part of that is being honest about what you're trying to achieve as an objective and what the other organization is trying to achieve as an objective, and understanding that you're not going to agree on everything, but this one specific area you're gonna collaborate on. And I think that sounds, it's very easy to just say what I just said, but practicing is a lot harder. And so when I sit down and talk to governments on behalf of Gilead or other entities, I try to level set and say, I don't expect you to understand or agree with everything we do or understand our policies, but you have this XYZ problem, we have this XYZ solution. How can we, let's figure out how to move forward in a way that gets you to where you need to go and helps us in terms of what we're trying to achieve in that particular country or setting. And so, again, sounds basic, but it comes down to that, because at the end of the day, these partnerships are run by humans, and we're imperfect creatures, and we all have to understand that as well.
I agree with you. It's almost like when you come to the table with your relatives and you're trying to break bread, there are just certain parts of the conversation you're going to gel on. So let's keep the conversation rolling there, and everything else, for the sake of the congeniality of the party and for the health of the family beyond, let's just keep it right here today and come to the other thing when we have to fight for something else, but that's real. And I was having a conversation with another group yesterday about the significance of trust and transparency, but also the reality of mistrust within certain, that's inherent in the structures of organizations that have not made an intentional effort to be really inclusive in terms of who is at the table, who is holding power, and who they are convening to have the hard conversations, especially around something so very politically charged as a vaccine, right?
Yeah, exactly.
And it's not easy, to your point. Gerard, so we have about 7 more minutes-ish before Brandon comes and does the Sandman thing and appears on the screen. Let's talk about some things that maybe have not come up yet. What, and not so much closing remarks, but what would you want people to know in terms of the work that you're doing, in terms of the work that your colleagues are doing, whether within Gilead or outside, or even some of your other co-doctoral students, your cohort members, and with respect to vaccination and global health?
Yeah, I'm thinking about it here.
It's a broad question.
It's a broad question. Yeah, I guess what I'd say is, again, from the Gilead perspective, it's so I've been working at Gilead for 7 years. It's
7 years already. Wow.
It's been 7 years, which is, yeah, it's just a long time. I've worked on the Hill. I've worked with different NGOs, and I've worked with community organizations as well. And so what I would say from a career perspective, it's helped me give a full appreciation of all of the different pieces of a solution, right? And when you're on the Hill, sometimes you don't have, when we're trying to assess, as a former Hill staffer, what's right, what's wrong, or what really the need is, because we have organizations and people coming to the Hill all the time asking for things. When you have a fuller picture, it helps you at least understand pieces of the puzzle, right? And so I guess what I'm trying to say is, try to think in an integrated fashion to the extent that you can about solutions, about how to, not only for COVID-19 or for anything you're working on day to day. And thinking in an integrated fashion means understanding who else needs to be at the table, who else needs to be part of the, in the room, so to speak, or part of the coalition or part of the solution. That's what I do at Gilead every day, and is trying to bring in other people from the outside, because I know we can't do it alone. And so I would encourage everybody to think that way if you're not already in your work, whether it's at a local hospital or an NGO or a major UN organization, because it takes, going back to that word humility, understanding that you alone can't do it, or one organization can't do it, and you have to develop those partnerships. At Gilead, we're open to that. We have we create funding opportunities for organizations in the US and around the world, because we know that they're the ones at the front lines doing the education, doing the healthcare worker training, And so we're open to those kind of partnerships. And me personally as well, if I'm just working on issues locally here in Northwest where I live near Shaw. I just know that it's a simple thing. The other day we were talking with some community members about getting more trash cans, litter boxes on our street, and it's it's a very local issue, but we knew that we had to talk to our ANC director. Then we had to get our ANC director to speak to our representatives, and we had to build that coalition of support that we needed, and we had to get more neighbors together. So it takes time, but ultimately doing it together, you end up in an integrated way. You end up becoming more effective.
What I hear you saying is it's a practice. It's an intentional practice, and no effort is too small, right?
Yeah.
In my estimation, the more practiced you are with being an advocate, and not just for your own wellness, but again for the sake of your neighbors as well, then it becomes a lot easier or a lot more realistic for you to ratchet that up to broader scales, right?
Yeah.
No, that I appreciate that visual. I can see you on the street, talking to your neighbors.
My clipboard and
all that for sure. And
but being intentional about it, you said it better than I did. That's the point, right? And and it's the same thing if you're trying to promote diversity and inclusion. If you're not intentional about it, and you don't do it purposefully, then it just becomes a slogan. So absolutely.
And I like also what you said about, at various parts of the development of whatever initiative you're working on, asking yourself who else needs to be at the table. And that's a question you not only ask yourself in the beginning of an effort, whether it's, COVAX related or what have you, but it's something you ask yourself iteratively throughout, the entire process. Who else needs to be at the table? Who may I not be talking to right now, but I ought to be at every juncture, in the beginning, in the middle, several times, and in the end, absolutely. Especially if you're trying to get at a certain outcome. So I'm excited for you. I'm so glad. This felt like I was just sitting in your living room and we're just talking. And
same, Mia. Thanks. You're such a natural. I appreciate it. I don't know how you do it all, work and school and life, but I appreciate all that you're doing as well. So thanks, and of course to Brandon as well. Thanks for having me.
Yeah, no doubt. Thank you, Gerard. And please, where can people find you if they want to follow your work?
Facebook, LinkedIn, Twitter, I'm all over it.
Yeah.
Not a lot of Jirair Ratevosians out there. So.
Right. I only know the one.
Yeah.
So thank you so much. I'll turn it back over to Brandon.
I think we're good on Jirair Ratevosian. They have a really good one. So
thanks.
That one. So thank you both. It's always good. You see why Dr. Puckering wanted to choose these two or folks like these for our advisory board. They're always keeping us together and making sure that we're doing sort of the work that needs to be done. We will be here next Friday again, so we look forward to seeing you all there. And I'm trying to think the quote that Gerard said. He's like, for the just essentially you just need to do it for humanity, right? You need to do a lot of this stuff just for humanity. So with that, I just hope everyone has a great weekend, and I will see you next Friday. Thanks.
Shout out to your shirt, Brandon.
Oh yes, I'll always Xavier. So.
Right. Thanks, you guys. Thanks, everybody.
Thanks, everyone. Be safe. Stay hydrated.
Bye-bye.